Hi everybody, Dr. Cary here. Thanks for joining me for this webinar called Embracing Tomorrow, Key Innovations in Healthcare. And today we're going to talk about how healthcare is changing, what you can expect going forward, and how it can affect our private practices. I've been in healthcare for 30 years now. I've owned my own clinic for 25 of the 30 years. I did a number of locums early in my career in different clinics, so I got to know different styles of practice. And then when I was moving from one clinic to another, establishing a new one, I did locums again. So I've worked in over 80 clinics now. I've had my own clinics, and I do use a lot of technology in my practice. And technology is going to change healthcare. I think it's going to make it better, and we're going to talk about that today. So for artificial intelligence, that's the first thing I want to talk about. How can this be a game changer? Well, people are afraid of AI and they're concerned about where it's going, but I kind of see it as a tool, something that we can use to improve our practices. And the way it's relevant is AI can help us like an assistant that's knowledgeable to help with things like predictive analytics. So let's say you've got a diagnosis of a patient, or you're not sure, you have a differential diagnosis of a patient. You want to know how the symptoms relate to their diagnosis. Maybe the symptoms are changing, and you want to make sure that you've got the right diagnosis and the right treatment for them. AI can be very helpful that way. It can also help you with percentages or determining the outcome of a patient's case, and some things that you can do to help that patient to get the best outcome. So I see AI as an educated assistant. It's only going to get better. And of course, with our knowledge and experience, we're going to make sure that if there are any errors, we're going to double check the references and make sure that the recommendations are best for the patient. So it's not like AI is going to take over, but it is something that we can use as a tool. I think the other thing we can do is we can automate our clinics using AI. So whether it's writing an article, posting a blog, some of the processes in the clinic, including reminders or when progress exam or lab results are ready for the patient. This is how we can use automations and technology in the clinic to streamline our administrative tasks and even help us with things like marketing in the clinic. Telemedicine. Well, that's something that we all use in our practices, and especially in the last few years, it's really taken off. I think telemedicine will make it easier for patients, especially that have to travel a long distance to see a specialist, to get our care, to follow up with us. And we can integrate telemedicine into our practices. Now, depending on what kind of healthcare professional you are, you might use more telemedicine. Let's say if you're a counselor, psychologist, psychiatrist, you could use more telemedicine than someone that's more physical, like a physical therapist or a chiropractor. If you're a medical doctor or nurse, you could probably be somewhere in the middle. So I think going forward, using a hybrid model, and this can really help us to just take a break from seeing patients in the clinic, do a couple consultations online. Of course, just having the information ready so you're not fumbling with the information, having your assistant put up the lab results, making sure the reports are ready. It's a little bit different in a way than seeing the patient in person, but a lot of our materials presented on screen anyways in the clinic. So it's not too far of a stretch to use telemedicine in the practice. You could also do classes, educational kind of webinars like this one, using group coaching, group health coaching, and telemedicine that way. Also, this can help with improved engagement and satisfaction through virtual consultations. If a person doesn't have to travel, it could make it a lot easier on them. Their family can join, especially if their family's from in other parts of the country or the state or province. So there's a number of different benefits. Now, of course, the limitations are if you don't know how to use the technology, or if the patient doesn't, that can make it challenging. But you can always switch to another platform, using Microsoft Teams, or maybe Google Meet and Zoom, and then having the phone as a backup of, there's a number of different ways we can do this, but just using that technology wisely to do a hybrid model of seeing patients in person and then using technology as well. And then personalized medicine. So we want to be able to use more personalized medicine going forward. So we want to consider things like DNA analysis and genomics. We want to understand histories and genetics, genetic history, anything that runs in families, certain traits, certain treatments that are beneficial to these genes and how the genes express themselves. I've always been interested in epigenetics, which is the way that the environment or our diet modifies the gene's expression. So I think there's a number of different ways that we can integrate this into our practices as the information becomes more available, more reliable over the next few years and even the next decade. Now, if you have any questions, you can type them in the chat. I'd be happy to answer those questions for you. If you're watching the recording of this, feel free to type them in the chat. I'll periodically check the messages, and then I can respond to you. If you're interested in following up with us, there's a couple things you can do. My book called Successful Private Practice is on Amazon. And if you're in private practice, you're a doctor or a therapist, this book is good for you because it'll talk about different ways that you can improve your practice, make it less stressful, improve the efficiencies in the practice, and lead to better outcomes. So I think that's something that definitely you can go to Amazon and get that book. Also, if you want to join our masterclass on this topic, so you really like this webinar and you want to know more, we're going to do a deeper dive into this topic at our masterclass. And if you go to Eventbrite, you'll be able to get a ticket for this masterclass. It'll be coming up in a couple days. And then the platform, we'll use Zoom. It'll allow you to interact more with me rather than being more webinar style. It'll be more interactive, and you can raise your hand, come up on the screen, and ask specific questions for your specific situation. So that masterclass is going to be in 2 days, and you can get tickets on Eventbrite where you got a ticket for this webinar. What are the next steps? Well, you can join our masterclass or buy the book. You can also go to our website, trueexpert.pro, and you can see the number of different services we have to offer there. B2B, between healthcare professionals, and B2C for people that want to get in better shape, they want to lose weight, they want to get more active. We offer the B2C services there, as well as B2B for other health professionals to improve their practice. You can also sign up for coaching. I have group coaching available, as well as one-on-one coaching on the website. So if you go to trueexpert.pro, you can see the coaching services that are available there. And here's our contact information. So it's trueexpert.pro for our website, info@trueexpert.pro for our email address, and our phone number. You can call or message us 778-215-9310. I want to thank you for joining me today for this webinar, and I look